Okay. Good day, everybody, whatever time of day it is where you're at. My name is Lombe, coming to the conference from Zambia. I am representing Zambia Network for Sickle Cell Disease, Amplified Voices and Advocacy. This organization is an advocacy organization that was launched in December, last year in December, and it was launched in May this year officially. So we had our first sharing of the commemoration in Zambia as an organization this past June. And I'll just take you through briefly what the theme was, what the discussions were, and what the conversations were. So I am looking at it, I have picked health promotion, and I'm looking at it from a Zambian perspective. So we participated in this year's WSCD, and the theme for Zambia was achieving equity in healthcare, access for people living with sickle cell disease. And as Zanseva, we looked at 4 cardinal points. We looked at the sickle cell trait. We emphasized on testing. People ought to test and to know one's status. We also looked at newborn screening. We looked at blood donation and blood transfusion services, and we also looked at mental health care. So I think we all have a slight idea of what the kind of geographical statistics in the sub-Saharan part of the world. Sub-Sahara is believed to have the highest population of sickle cell disease, and Zambia is within sub-Sahara. And for Zambia, apparently, because of the prevalence of malaria, it is actually one of the 20 countries in the whole world, that has high prevalence of sickle cell disease as well. Even though sickle cell disease has been a major public health concern for a long time now, it was not taken on as seriously as it ought to have been taken on. But we are glad to say that as of about the 20s, when in the early 20s, the government started noticing that this now was indeed a huge public health risk, and more recognition and more conversations and a lot more activities started happening around sickle cell disease. We can still say that about 20% to 25% of Zambian population are trait carriers, and 1% to 2% of children born in Zambia actually do have the disease. I am an advocate because I am a sickle cell trait carrier, and I have a daughter who has sickle cell disease. So I have gotten into advocacy because it has become a very cardinal part of our lives as a family. According to the World Health Organization also, the burden of sickle cell disease is a public health. It's a global public health. It's a global threat. It's a global crisis. And so the following are the 3 that the WHO believed would have to be looked into to balance, disease management and the prevention programs. One was information dissemination, education and awareness. The second one was effective sickle cell trait testing. And the third one was newborn screening and early diagnosis. So when you look at sickle cell trait, it is sad that out of a population of about currently 20,036,000 plus in Zambia, I think we can say less than 15% actually know their status when it comes to sickle cell disease. The sickle cell trait is not talked about. There is not much awareness. People are just starting to learn about it. And we feel there is much more that needs to be done. We need to go into serious programs, serious awareness programs. And we are glad that at global level, it has also been recognized. Because if you look at our statistics, if we say there's at least 10 people in a room in Zambia, at least 2 to 4 of the people in that room will carry the trait, but will not know that they actually carry the trait. So the risks are still very high, and the numbers are really going high. We've got the University Teaching Hospital in Lusaka, which is like our major referral hospital. And we've also got the Arthur Davidson Children's Hospital in Ndola, which is also another major referral hospital for pediatrics. And currently, these two hospitals alone share about 16,000, of SCD patients in Zambia who are currently registered. And those are only the ones that are registered. Some of them out there in the rural areas are not even registered. The statistics are not even available. And it is believed that right now, sickle cell disease is among the top 4 causes of admissions in these 2 big hospitals. So when we looked at access to quality health services, we were looking at things that were pertaining to people having quality and equity to health services in Zambia. So we looked at, one, lack of trained human resource in managing sickle cell disease. We looked at the lack of information and lack of awareness programs and data. We looked at the lack of drugs, vaccines, the lack of sickle cell disease drugs, prophylactic drugs availability, and the lack of equipment and medical supplies. We also looked at the lack of infrastructure, the lack of development in infrastructure in Zambia. And then we also looked at lack of health finance. Now, just to break these down, we further looked at who is more impacted. And in Zambia, there is a sad story when it comes to adult sickle cell disease healthcare management. Adult sickle cell disease healthcare management in Zambia is nearly non-existent. We do not have expertise, we do not have specialties, we do not have the infrastructure, there's no bed spaces. And as we said before, the only hospital that is a referral for these adults is UTH, the University Teaching Hospital. UTH is burdened. UTH's capacity cannot hold the number of sickle cell diseased people that are, treading in and need inpatient care. And especially for the adult sickle cell disease population. With the pediatrics, in the past 8-10 years, things have really been, they've started ironing them out. Systems have been put in place and they are working, they are being tested. And for the pediatrics, things seem to have settled and we're really having good stories and we're going far. But with the adult care is where we have a problem still. So we are looking at things like admissions, we are looking at readmissions, we are looking at things like mental health care, because it is believed that adults with sickle cell disease, there's an average of more than 50% annually who visit, the emergency department at the UTH hospital, okay? And with 29% of these visits being admissions. But when you don't have the capacity, when you don't have the bed space, when you don't have the medication, it has become a huge problem. And what has happened now is adult sickle cell diseased patients are actually facing immense stigmatization and accusation of drug abuse. There's mistrust by providers. There's the common theme of being addicts and just wanting attention. And we feel there's a lot of advocacy and awareness that needs to be done. Now, another thing that we have looked at as Unsaver is to calcate and to emphasize in the warriors to be their own advocates. They need to speak up about their condition. We also need to be advocates, not just for the general public, but for the medical personnel as well, because there's a lot of misinformation and there's a lot of information that is not, available to our health management team as well. When you look at mental health in sickle cell disease management in Zambia, I think it's there's even no statistics to back this. It's sadly very, 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 very silent. It's nearly non-existent, you know, and I think it's because of the nature of the budgets in the medical sector and the nature of what was prioritized in years past when it comes to, you know, to the medical budget. So when you look at medical budgets and lack of infrastructure, mental health has really been impacted in a very negative way, especially deep down there in the rural area. Now, in Zambia, 89% of our sicklers, of our warriors, are coming from the rural area. And that is where there's a lot of abuse of alcohol, there's a lot of malaise, there's a lot of poverty, there's a lot of vices going on. But we do not have mental health care right there at primary level, you know, even within the cities. I think we have a few private healthcare centers coming up, which are very, very expensive. Zambia right now, as the government, has Chainama Medical Hospital in Lusaka, and it's got an official mental block as well in Ndola. I think in Ndola, the capacity is only about 150 patients. And for Lusaka, I'm not sure what it is now, but it could have been about 1,500 or less. And these institutions have not grown. There has been no capacity building. There has been no addition to the infrastructure. And so you find that, you know, the projection for mental illness has become a burden. You know, the increase is said to be about 15%. You know, it was about 15% by 2020 or even more. And this is an area where we are still working with the authorities. We are still pushing the agenda, a total complete agenda for sickle cell disease management with the Ministry of Health in Zambia. And we pray that, you know, we do see much more being done for mental health in Zambia. And the lack of drugs, as we all know, hydroxyurea is what everyone is widely using. It's certified. It's got positive success stories. Unfortunately, hydroxyurea is not really available in Zambia. Our government establishments do not stock it. There's a scarcity of this drug. Even our pharmacies do not all stock it. They're very, very specialized few that stock it. And when you look at the price, it's about $1.50 for about 10 tablets, 10 capsules. And for example, my daughter is on 2.5 capsules, and that 150 for 10 capsules is just not even sustainable. The people who are impacted by sickle cell disease, who require this medication, cannot even get their hands on it. So that is one of the other problems. The other problems we have that we looked at was blood donation and transfusion services. Blood donation, I think worldwide, has become a huge, huge crisis. People are not donating blood anymore. There's a shortage of blood and blood products globally. Zambia is no exception. We are working closely with the blood bank, you know, to see more massive blood donations coming in. We are also working with the local communities. We are talking about blood donations. We are talking about blood transfusions. Blood transfusions is the best form of treatment for our warriors currently. But you see, we have, as if the donations are not less, we also have a problem of religious beliefs, cultural beliefs, and traditional beliefs. And so we have to cut barriers and tell people that it is safe to donate blood. It is safe because the Zambia National Blood Transfusion Services know what they are doing. You are in safe hands. Another thing, as I have done my research, that I have discovered is a section of our population do not want to do any exchange of blood without being given financial award. That is a terrible vice that has come in. And this shows, you know, the faded moral standard due to poverty levels, you know, vis-a-vis ills in the society. So we have got a big services as well. Nutrition is another area. I mean, already we are looking at families who live at $1.90 a day under the poverty datum line. And so it's a fight of priorities. They would rather buy grain for the family to feed than spend money on one person or two people or three people to have medication. So it's still a far fight. And just generally, nutrition, food is very expensive in Zambia. I mean, the rural areas do produce their own food, but it's mostly grain. It's not a balanced diet. You will find that there's a lot more grain, a lot more wheat and maize products, and there's not much vitamin, there's not much protein, and it's a very, very imbalanced kind of diet that they are living on. And then when we look at institutional health finance, I think we've already talked about this earlier on. This is also a global problem. Sickle cell is generally not funded. As the World Health Organization has noted that only 1% of all the funds from donors, from international aid and so on and so forth, only 1% of that is actually allocated to sickle cell disease. And we are crying out to, the governments, we are crying out to the global funds, we're crying out to the donor aid communities, to philanthropists, to well-wishers, to have sickle cell disease in mind and to start, apportioning monies to the fight and to the management of this disease, especially in Africa. It has far been neglected. This has become a public health risk. It's affecting the productivity, it's affecting the economic activities and the social lives of people. So surely we all ought to come together and look at this vice and see how we can put our hands together, funds that are available, to be equally channeled into sickle cell disease as well for a better, outcome for the whole world, I believe. Newborn screening, we thank God that newborn screening was introduced here in Zambia in April 2021. Currently, it's in 3 provinces. It's in the Copper Belt and it's in the northern region. It's at the University Teaching Hospital, and it's at the neonatal center at our pediatric hospital in Ndola as well. This is an area where a lot of mothers, a lot of fathers, and a lot of the public do not know about. So we have started, public awareness, getting knowledge out there that we actually do have newborn screening in these 2 major places. So should anybody require these services, should you notice that your child or any of your family members require these services as they, as newborns, please do bear in mind that we do have these 2 facilities for newborn screening, and we are fighting for more because I mean, this is a population of more than 20 million, and the new births are in thousands every day. So these 2 centers will not do. We will need more centers, to cater for the newborn screening program. And as Zanseva, as an organization, from what we looked at, we came up with 6 core initiatives. We are lobbying to build a sickle cell dedicated hospital. We are lobbying to create and provide reliable support networks. We are lobbying for availability of point of care testing equipment. We are looking at participating in sickle cell disease related research. We are lobbying for the annual Sickle Cell Day to be recognized on our Zambian calendar. We are also lobbying for all sickle cell advocates, and organizations to work together. And so this brought us to the following aims and objectives: awareness and education, testing and diagnosis, blood donation awareness, blood transfusion education, newborn screening awareness, sourcing of medication and distribution, active participation in research and development towards novel therapies. Now, we have already partnered with the Ministry of Health, who is the ministry department in the government of Zambia. We are pleased to say that we were received with open arms. We are working with them. And I think as an organization, our main responsibilities right now are looking at change of policies, looking at policy making and policy tailoring, we have to go back to the table and look at the policies, because none actually did cater for sickle cell disease, and none of the policies catered for the growth in the trajectory of these numbers. So we are lobbying with our government, the Ministry of Health, with the authorities. We go back to the drawing board, we look at the policies, we look at what is already on the table. What does the World Health Organization say? There's already laid out guidelines and working with documentations to work with. So as a country, we just need to get together and start redesigning policies that will ensure that all these aspects that are required for sickle cell disease to be managed in our country are actually going to be looked at. And I think